So tell me just a little bit about what you're learning about cranial.
So, a lot of times I get asked, should I do rapid palatal expansion? Do I need the MARPE, which is like the surgical implants on the roof of your mouth, and that suture is cut open, and then you're opened up and expanded? And how this has been taught to me by my mentors. Again, this is my opinion and how they have been working, is that you have this system here. So you have your maxillary teeth, and then you have your nose that inserts up to here. Everything's all connected. So when you get a MARPE done or anything surgically done, what you're doing is you're splitting that open. Well, now the septum has to choose a side because it inserts
Mm.
and attaches from here to here. Now you've broken that attachment system, and now it has to choose a side. So yes, MARPE does help get more volume in the lower nasal passages, but it actually restricts volume in the upper nasal passages because of the tension, because you are doing this. And when you're opening, you're causing that to push harder on each other up at the top.
Okay.
So slow palatal expansion is what my mentors have told me that they prefer, because what it does is it's that slow, and it allows that tension to be dispersed before opening up again. So now you're getting more of like this motion rather than this motion.
Hmm.
Um, and the septum is what causes the nitric oxide release, because the septum attaches down here at the vomer to up at the cribriform plate, and the tongue to the roof of the mouth causes that septum to pump just a little bit, and that pumping motion is what stimulates the cribriform plate to release the nitric oxide. So if you remove that attachment, now you're turning off the way that the nose breathing gives you nitric oxide.
Oh,
It
wow.
will reattach. I believe the system will turn back on, but you're temporarily turning it off, right? Because that septum is not just going to dangle and hang. It's going to choose one side or the other to go with. You split the path, it's going to go this way. You split it, it's going to go this way. It's not just going to dangle and hang.
Hmm. Hmm.
Um, so that was just something interesting that I haven't ever thought about, because I'm always wondering why not go the surgical route, or why go the slow route or other things. And within like cranial in mind and osteopathic considerations in mind, it's because it's of the torque that's put on the system that then shuts off the harmony of everything else, because it all works together. So I think dentistry, we're pretty myopic. We deal in millimeters. We look at teeth all day long. We think, oh, doing this, it's going to open up. It does open up here, but what about everywhere else? What has to compensate in order to get that? And so, and then are you getting an osseous union, or are you getting just a soft tissue union? Is it scar tissue and everything else like that? So my preference is always, and my gut has always told me, let me try something non-surgical. And then when I heard all this stuff, then I was like, that makes sense to me. And that makes sense to what my intuition was telling me with different things. And so I get expansion and development non-surgical ways to allow disbursement of the tension along the sutures while still getting the alveolar process wider without cutting into that suture. And it's less invasive as well.
Mm. Yeah, absolutely. It that sounds much more comfortable rather than having one's mouth sliced into as well. Ooh.
But lots of different ways to get from point A to point B. I see some of my colleagues doing beautiful MARPE work, and they're saying they're getting way increases in nasal breathing, which they probably are. So just different ways to skin a cat. But my idea, less invasive, and with all that measurement, yeah, you're getting that increase down here, but what about up here? Because a lot of people who get MARPEs, they say they start to get like more headaches, or there starts to be tension here. That totally makes sense
Mm.
because of how you're putting pressure onto that system.
That is very interesting. Yeah. So it's good to know that there's lots of options. So you mentioned chiropractic work just a little bit. Who are you training with to learn more about this?
Yeah, so all the cranial manipulations, all the stuff that I've learned about how the sutures work and how to get the head end torqued, I've learned through Dr. Bob Walker. He teaches the course Exceptional Dental, and it's chirodontics. It's really cool because he's a chiropractor, and his significant other is a dentist. And so they've figured out how to marry the two together and how to get the whole craniofacial system working better. And so I've just really loved learning more from him, and it's been a great addition to my practice.
That's awesome. Look at you putting all these systems together.
That's a great question because you want to see, hey, not everyone can come to Utah to come see me to get treatment. And so what can you do? I would want to verify a few other things first. So this is kind of not a one size
Question.
fits all for everyone. I really like lip taping and the ability to breathe through your nose, because the nose warms, humidifies, and filters the air. And it helps you to posture your tongue onto the roof of your mouth. With your tongue onto the roof of your mouth, you are stimulating the vagus nerve. You're going out of this fight or flight and more into this rest and digest. And you're expanding the palate, and you're helping pump that system so that you can get some nitric oxide. Nitric oxide is a vasodilator. It helps your heart and your lungs work better, all by breathing through your nose. It's great. For someone who cannot breathe through their nose, I'm not going to tell you to lip tape your mouth right away. But for the majority of people, they actually can. And so try some lip tape. I like dollar store lip tape because it's not super sticky. So if you need to break it, you can. It's a little porous. For kids, I like the square Mayo tape because they can still open their mouth and breathe, but it helps close their lips together, remind them to close their lips together. But then it's a really cheap way to help you breathe through your nose all night long. When you wake up, you feel more energized, more refreshed, and your nose is more open already, because the nose is a use it or lose it function. So the more that you breathe through your nose, the more that you have the ability to breathe through your nose. But what I start with patients is try wearing it a couple hours in the evening. And don't try it the first time when you have a cold and you're stuffy. That's the wrong time to give it a first go try. But try it in the evening. Prove to yourself that you can do it and it's just fine. Also, purposely open your mouth a little bit. See that it doesn't take a lot of force to like open your mouth, and you're not going to suffocate yourself, and you're going to be okay. The reason why I like to do all my work before is because I with the x-ray, I'll be able to see if you have a severely deviated septum, and I'm probably not going to give you that recommendation right off the bat with things. But the cheapest, easiest, most applicable way for the majority of people, I'm not saying 100% of people, let me just clarify that, lip tape. It's great.
That's fantastic. Awesome. Thank you so much, Dr. Brittany. I really appreciate this. This has been so fantastic. So much great information, and now people know where they can get started, and if they want to come see you, you're in Alpine, Utah, and
Yeah.
they can get started.